Thank you, Melanie. I appreciate it. And I appreciate all my University of Delaware colleagues who joined the call. Thanks for joining me this afternoon. Just real quick, I'm just going to go over what we'll be talking about today. And we're going to be talking about just a project overview of what happened over the last year with the EFNEP and Excite teams and, give you some examples of some of our work and where we're going, the implementation of the project. We also were very adaptable, like the FNEP team usually is, depending on the community needs, the funding agencies' needs, and then also talk about our reach. And it's actually updated since you got this advertisement about today's center stage. So I'll give you that grand number. And I saw Tia was on. Thank you, Tia, for helping get all that data together and collected from Mississippi. Then we're going to talk a little about like what's coming up, what's the sustainability, how are we sustaining this effort that made such an impact to our community regarding immunizations, and then what's next. And it's not just what's next for those who were involved in this FNAP Excite team, but what's next for Excite and the land grant system. So that's what we have in store today for you all. So we have a polling question to start out. And I'm just curious, did your institution have an FNAP Excite grant? Let us know. And maybe you didn't even know what was going on. How are the results looking for that, Melanie?
We have 86 people participated. I'll give maybe just a couple more seconds and then I'll end to see the results.
Okay. Great.
Okay, you should be able to see the results now.
Yep, great. Thank you so much. So 52% of you said that you did have an FNEP Excite grant. So thank you for participating and taking a chance with us on that pilot project and journey. 15% of you said no, and 33, which is totally fine, said you don't know. And that's because, sometimes we don't toot our own horns or we don't tell each other what we're doing, or, you may not find out about it. So that's perfectly fine. I will mention some of the institutions that did participate today and also talk about the institutions that will be that will be doing the work in the future as well.
I'm trying to get the polling questions out of my way here. Sorry.
No worries, no worries. Okay, so just for anyone who's not familiar with EFNEP, EFNEP stands for the Expanded Food and Nutrition Education Project. Each land-grant university has a EFNEP coordinator, and that's my role at the University of Delaware. So EFNEP has been a trusted messenger in the communities for over 50 years, 50 plus years now. We are a federally capacity-funded program. We concentrate mainly on community health, community nutrition education. So I have peer educators across the state of Delaware, along with Del State University, that go into community agencies, libraries, schools, to reach limited resource families about how nutrition can be easier, how it'll be easier to eat healthy foods, how it'll be cheaper to eat healthy foods, and just really make an impact in families. And we want to see a behavior change. So we have the same evaluation for all our land-grant universities across the country. Over 70 FNEP programs where we do a pre and post evaluation, and that data is collected every year, and we make our impact statements out of that. So for those who aren't familiar with EFNEP, I just thought I'd show this video we created at the University of Delaware about our 2019 impact and one of the community agencies we work with. So just take a look at this short video.
Hello, my name is Desiree and I run a food program for Catholic Charities here in Delaware. Catholic Charities has been helping the community for over 190 years. We've partnered with the University of Delaware Cooperative Extension a little over 15 years ago to give our clients the building blocks that they need to have a little bit more food security to help stretch their budgets and to live a healthier lifestyle. I really want to thank Jennifer Seabrook Scott for an awesome partnership. We have been able to bring a sense of community to our clients to help form friendships and bonds with others in need.
So that was a quick little introduction to our EFNEP at the University of
I'm sorry.
Delaware.
Hold on. I'm trying
No
to get
worries,
to
no
the
worries.
slide here. There we go.
There you go. So I'll hand it over to Jackie now to tell you a little bit about our initial objectives with this project.
Great, thank you. It was nice to see a little bit of that in action. And we're very excited about what this entire initiative has been able to do and to be able to tell you a bit about the specific aspect of EFNEP. And so the project history as it relates to the Excite Bridge Access Program, which is what Diane and I began this project with really in year 3 of the full, I'm sorry, in year 5 of the full Excite, first 5 years of their project, was focused on the need for increasing awareness of eligibility for the COVID-19 vaccine at the time, and then increasing awareness of when and how you could get an updated COVID-19 vaccine for anyone 18 and above who were uninsured or underinsured, which turned out to be quite a few people at the point in time that the free vaccines had stopped being provided, and it had moved really into kind of a corporate space. And so we our project partners, primarily CDC, wanted to make sure that individuals had access to that free vaccine while it was available. And in order to do that, they wanted a trusted messenger to be able to talk to those around them in their communities and work with partners like pharmacies to make sure people are aware of it, how to get it, and where they were actually available. And so that was what we started with for our initial objectives. As Diane alluded to a little bit earlier, we had to pivot pretty quickly into the project about 3 months in, as those free vaccines were no longer funded through the federal government. And so we had to pivot and have all of our partners work on increasing awareness and confidence regarding all adult immunizations. So we were thrilled to have those that had started with us with the first objectives. We only lost a few when it turned into quite the pivot for that second set of objectives. Diane?
So some of you may wonder, okay, why did EFNEP get this opportunity? EFNEP has a great reach, and we always had a good reach, a good rapport with the community members. So, like I mentioned, there's over 76 institutions across the country that provide EFNEP. And there was an RFA that went out through the Extension Foundation for between $50,000 and $70,000 to do this work. EFNEP, they're trusted messengers. Like I mentioned before, they are peer educators. They live and work in that community that they serve. So they already reached the priority population. And just to make sure, we actually made sure we were reaching the underinsured and the uninsured communities by using the Sparks map, and made sure we got our messaging in those communities. So we were able to integrate this message first about COVID and then COVID-19 and then about general adult immunizations as we went on. So this program, although it was CDC funded, it was an interagency agreement between CDC and USDA NIFA. So then the NIFA awarded these funds to the Extension Foundation. And in the end, 31 EFNEP institutions were awarded over $2 million to do this work. So let's talk a little bit about what EFNEP was actually doing. And these are final numbers. I didn't put every little detail on here, but just to give you an idea of like what was EFNEP really doing. Well, EFNEP, as you know, goes into the communities. We have a series of 6+ lessons that we talk about nutrition. And in addition to that, we're also sometimes at health events, health fairs to get our message out there. So we reached over 94,000 individuals with this message about adult immunizations. Sometimes me as a coordinator, I also attend virtual meetings with community groups. So for example, I did one with our immunization coalition here in Delaware, an immunization mobilization group that I meet with on a monthly basis, just to tell them what we are doing and where, you know, these were available. We can provide flyers for you. We can talk to groups for you. And over almost 1,500 people were reached in the virtual world. We were also able to do some mass communications. We did some newspapers, people were developing podcasts. We also had radio ads out there and also bus wraps, bus messaging, and we reached about 833,000 people with the mass media. But social media was also a big reach for us, where over 6 million were reached. So either cooperative extensions put it on their social media, or the EFNEPs put it on their social media and got it out there. And again, if you don't know, we can tailor social media messages to get to the communities we want. So we made sure we reached certain zip codes to make sure they knew about these free resources, and then about the other adult immunizations they should be asking about. We had 11,000 direct communications, over 11,000 direct communications. And what that included were like maybe text messages that went out reminding people to get your free COVID-19 vaccine here, or constant contact with email. Some of your institutions may have that. We also put that out there with some of our constant contacts. But the really big reach was our print. So this means brochures, that we put out there, a lot of newspapers as well we use. So over 16 million people were reached with that. We even had some individuals work with vaccine providers and educate them at different fairs that they may have been, or community events they would have been. And we got 1,100 people vaccinated because of these efforts.
Diane, did you just want to talk maybe a minute or two about the support that we provided through Excite to make sure that
Sure.
everybody understood what was available and was able to share?
Yeah, so we usually had these monthly meetings with all the different 31 FNEP institutions were invited to our, I almost forget the name of it, it was like a spotlight.
Spotlight, yep.
That we had on a monthly basis, where we would invite different FNEP programs to talk about best practices or what's working for them in their state or their area. So here in Delaware, we were reaching the Spanish community, Spanish-speaking community, through some of their local Spanish newspapers. So we highlighted that. We highlighted some of the other different institutions about some of their work. I know one of them is doing a website development. I know University of Maryland Eastern Shore did a website development that they pushed out to their communities. So we like to share a lot. We didn't want people to have to come up, reinvent the wheel. We wanted to share our resources, like Extension is so good at doing anyway, and just share what we can share with others. University of Texas shared their flyers with us, so we just had to adapt it to the University of Delaware, put our logo on it, and send it out to our different community groups. But it was already done for us. We just had to add the logo and get it printed.
And then we also brought in a variety of experts that could help, like for instance, with social media. Maybe you've done a bit of it, but you haven't understood how to have those direct marketing aspects of it, or ways to really tell the message effectively and precisely. And so we bring in Washington State University, for instance, was a partner of ours. And then we'd bring in speakers from CDC, or our collaboration with NIFA, and making sure that we were able to bring to bear the knowledge and research and science that's being done, where they've often loved this relationship because they will admit and readily admit that they do a lot of great research, but they're not always as good at translating that research into a way that's easily accessible and digestible. And then they recognize the value of this partnership at the local level. So altogether, it just really worked out well. And as Diane indicated, everybody didn't have to create everything themselves. There was a lot of sharing and idea tracking and idea generation. So it was very really effective.
One of my favorite projects, I think that someone did, was University of California. They used FNEP participants in the videos they created to get the message out. So that was another, FNEP participants saw themselves, learning about immunizations. They got their shot, on the camera. So it was a really nice kind of connection there.
Diane, just real quickly, one more thing. For those that don't understand how this funding was really helpful in being able to provide time and availability of individuals to be able to do the work for EFNEP, because some people might look at the mission and goals of EFNEP and a lot of the policies and approach and think, well, how did they do that? Can you answer that for me?
Oh, sure. Yeah, no problem. So those RFAs that turned into contracts, because FNEP is a very specific program and we just can't teach anything. We have to follow NIFA's, NIFA's guidelines on what we're allowed to talk about, what we're allowed to purchase. So these funds allowed us to incorporate other health education messages into our programs. So for example, I put 5 of my FNEP educators on 5% of this grant to allow them to be able to talk about other things other than FNEP during these classes. Again, FNEP was always the focus of these classes, but toward the end of the class, or maybe when they were out at a health fair, they could mention these resources that were also available to them.
Thank you.
So our total reach, I feel like a drum roll should have been here, was actually 23,599,973 individuals. So we're very proud of that number. I think the CDC was very happy with that reach as well. And again, we were all over the country in 31 different places. So we've reached a great, a diverse audience for sure.
And that number is so fabulous. We know that we probably are underestimating that number because people then share it with others. But when I think about what our FNEP partners were able to accomplish with this in how much time? 1 year, right? And so I think we're
Yeah, not even 1 year.
Not even a full year. Yeah, exactly. So that's pretty crazy impact. I'm super excited to share that. And as we go through, we hope that you'll have some questions about how you might be able to implement some of this as well. So as you can see, we had a really fabulous first year of that project. Again, as Diane said, not even a full year as it got finally funds released, the pivot and all of that. And then, part of that time goes to your end of year reporting. And so our initial funded project ended March 2025. And our goal is to ensure some sustainability for this effort that just doesn't end. As you all know, many times you'll get a grant, you'll get those seed dollars and then it ends. And then everything that you kind of created for that, you're hoping has a chance to move forward, but it doesn't always get set up in a way that ensures that there's some likelihood of that. So our goal is to ensure some sustainability by providing additional support and resources for FNEP educators so that we can all confidently complement our adult curriculum lessons with vaccine education in those spaces and ways that make sense for your local communities. And we recognize that there's going to be some places that have the ability to do that, and maybe some additional funding for that percentage of time like Diane mentioned, or it may just be that you've got the opportunity to share some resources, as we often do through our FCS programs and partners within the state, family and consumer science educators, and then also in our SNAP educators roles as well. And then oftentimes just even at different events that extensions at. So how can we have different types of resources and mechanisms for sustaining this model as much as we can? And we're going to talk about some formal ways that we're doing that, and then also some more informal ways that we think we might be able to excite you all about, pun intended. So vaccine education we know can be shared through various formats. And really the goal is enabling educators to allocate some time for the initiative while also engaging participants in a manner that meets them where they are. We know vaccine hesitancy is a real thing. A whole variety of different aspects of our environment affects whether or not we have the time, availability, or the comfort with focusing on some vaccine education. So with sustaining the model, I just wanted to share a couple maps with you. One is our current reach through Excite, and then one is our potential or desired reach. And so as you can see here, this is color-coded by region. I think many of you will be familiar with that. We also have different types of institutions. So all of our land grant institutions include our 1862s, our 1890 historically Black colleges and universities, and our land grant tribal colleges and universities. And so as you can see on here, one of the things that we feel has been a great success is making sure that we have had the benefit of all of our partners across our land grants be active in the Excite initiative. And that's the broad Excite initiative. And so when I show you this map, it's really all the different Excite activities you can see on the right, 1 through 4, that included Vaccinate with Confidence, then immunization education, pilot projects, a design phase, and then what we were included in is that last activity, 3 of the implementation phase. So that's kind of where the Excite projects are. As you all know, extension is everywhere. And so one of the things that we always want to help people understand is that extension is across every single state We're in every county, borough, parish, and territory. And not everyone knows that, but when we meet new partners, they get really, really excited about this, and we kind of take it for granted. But we have a mechanism, as you know, for meeting the needs locally. If we don't know something, we know somebody who knows something, or they know someone, and then we can share and not recreate the wheel. And so our goal is to make sure that we're using our cooperative extension system across the country in ways that are going to help continue this work. Some of our partners, as you all know, partners are important. And when I say partners in this space, it's really about who are the primary partners for doing this initiative. But I don't even know, we talked about it a bit this morning at another meeting, Diane. There's absolutely thousands of partners that came out of who individuals are working with in their own states through their own initiatives. So I'm just talking really quickly about our partners, broadly speaking. And you alluded to them earlier, Diane. USDA through NIFA, National Institute of Food and Agriculture, is an incredible partner, as you know, where EFNEP is sitting. And then we have EFNEP, of course. And then the CDC has been a great funding partner, but also a great collaboration and programmatic brainstorming and resource partner. And then we're also beginning to work with some pharmaceutical companies who also want to make sure, don't know if many of you understand that they also have a mission for outreach and engagement for medically underserved individuals. And so we want to make sure that we're continuing to build those partnerships so that we can grow and continue and sustain the projects that we're working on. So we started out with discussions about how do we make sure that this just doesn't die on the vine as the funding kind of ends and the project reports have been turned in and we get to talk about our good numbers and then maybe it all ends. And so we had a really deep desire to make sure that we create something that can live on with a variety of resources and mechanisms to help us tell this story and be able to replicate it over time in, again, ways that make sense at the local level. And so it's a work in progress right now, so we keep calling it a toolkit. You'll probably hear Diane and I call it a couple of different things today, but it started out as EFNEP specific adult immunization education toolkit. And that's really aimed, again, at helping our EFNEP professionals be able to take some of this information in the way that they're enabled to do and feel confident doing and have access to resources and put them in this toolkit. And then we'll talk a little bit about how that's expanding over time to be more of an extension-wide adult immunization education resource hub. So I know Diane's going to go into some specifics about this. Do you want to take care of this slide or you want me to talk about what's on here and then you dive in?
You can finish up this slide and I'll take over the next.
Okay, perfect. So one of the things that Diane's going to share with you here in just a second is we wanted to make sure that there were some lessons for EFNEP professionals where you could actually take information that's related to the topics already required and handled so wonderfully by EFNEP, and then in a very non-threatening way, both for the presenter and for the one receiving the information, how do we relate those topics to the lessons that are already in place? And then we've also been asked to, because we've run across a lot of fact or myths related to vaccines over the last few years going, I mean, it's probably been that way forever, but certainly we ran into that with COVID-19 and then we run into that continuously. And so we wanted to cover some of that. We've got a wide variety of different activities. Diane shared a few of those as she mentioned things earlier. And then we've got a variety of flyers and handouts that are going into what's going to be an online and easily accessible resource hub or toolkit where you can access these yourself and be able to adapt some of them and use them broadly.
Okay, so EFNEP has a few focuses that we have to talk about during our lessons. Again, these are adult lessons I'm talking about, not the youth lessons. And one of them is meal planning and healthy meal planning. So we kind of wanted to, blend the nutrition education with the vaccine education. So we kind of okay, just like you're going to plan your meals, right? You're going to plan your shopping trips. You should also plan, your health care, plan your doctor visits. Plan when you're going to get your vaccines or your annual flu shots. because it's just like planning a meal for your family. Do it for your children as well. Plan those meals, plan those doctor's appointments. And doctors have gotten really good these days about sending text messages, about reminders, and adding things to your calendar and sending emails. And even I still get letters sometimes from my son's pediatrician because I forget about him sometimes. He's 16, right? About him, but making sure he gets his appointments done. And then we also talked about like maybe, how does COVID-19 affect things like your meals? So for example, getting COVID-19, if you were to get that, it can make it difficult to smell delicious meals you are preparing. So we want to try to prevent you from getting that, and getting the vaccine any time of the year is better than not getting it at all. So making sure they know, even though it's airborne, that you can get it anytime you like. So when we first came out with the Bridge program, that is when we gave, we were telling people about the free COVID-19 vaccines at different locations. It was free, right? So this was an easy one, shopping for less. I'm like, what's better than free? So just like you want the best prices on food, you also want the best price for your health. And this includes vaccination. And I'm learning with my baby boomer parents, this also has to do with medication. Shop around. So making sure, getting your vaccines, whether it's getting them through your primary care doctor or getting them through a pharmacy or maybe a federally funded healthcare facility. There's places you can get free vaccines, including public health in many of the states that, in many of the state programs. So if they're not free, they'll be on a sliding scale, which means they're going to look at your income and they're going to compare it to what could you possibly afford to pay for your vaccine.
And Diane, you just reminded me as you were talking about that with the primary care physicians and how they're always really interested in having useful, easy information to share with others, as well as the relationships that we've built with pharmacies, who we know are also trusted messengers oftentimes in communities. And so a lot of what's being created could also be shared in those partnerships as well. Isn't that right?
Yeah, even at the University of Delaware, it's the pharmacists that come out to give us our flu shots and our COVID-19 shots. So I'm getting used to the Acme pharmacists coming to our university. So again, physical activity is a lesson we have to talk about with our EFNEP lesson plans. So people don't want to go to the gym if they're, they don't want to get sick. Everyone's breathing heavier and coughing and trying to catch their breath. Some people fear going out in public. They wear masks still. They don't want to wear masks though when they exercise because it makes it even more difficult to breathe. So getting a vaccine, whether it be for COVID or flu or RSV, it can make it difficult to breathe for some individuals. So we want to prevent it from happening at all and getting those illnesses. Also, some of these diseases make physical activity people more sedentary because they're used to being very active, but when they get sick, they could be down for a couple of weeks. Symptoms can linger for a while, so we don't want you to get sick at all. There's also some recent studies out there that show individuals who are physically active may have a higher or lower risk of severe COVID outcomes. And that could be related to lung function and how well your body's used to the heavy breathing and taking those deep breaths. So just some things that are out there. Of course, we always have to make sure we check our website to make sure this information is still out there. So I just want to put that plug out there to make sure you check the website to make sure this information is still there.
And the last one.
So, go ahead, no worries. So, some of our partners are the pharmaceutical companies, and they came up with the idea of let's talk about like what do people not completely understand about vaccinations? Um, Fact or fiction. So we're going to talk a little bit about some of these facts. So, how often should these people get vaccinated? So this is something that we can talk to adults about. Obviously, the flu and COVID-19 are seasonal now, but RSV may be something they're not as familiar with. So at least every 2 years would be good for getting the RSV as well. So putting these simple messages in front of people, something that they can remember and understand. We'll also have handouts for them to take with them, different vaccination guides for adults in some of our online modules as well, is something we'd like to share with them. And then also, because the pharmaceutical companies they wanted to give some input on what's being shared out there. So we're like, okay, they've said, what about you talk about myths versus facts? So this is just one of the, is this a myth or a fact? Messenger RNA vaccines can make you sick or alter your DNA. That was something that was shared out there a lot during COVID, right? So we want to make sure people understand that it's not going to alter your DNA, and give them the facts about vaccines and how some of these vaccines are developed. So I believe, is it the next slide, Jackie? We're going to ask for some of those myths.
Yeah, absolutely.
Okay, so in the chat, if you don't mind putting, what are some other myths that you heard about vaccinations that we may come across out there? We kind of just want to see what other people are hearing, and then we'll put some of the other ones we're talking about up on the screen for you. So any other myths that you've heard of in terms of vaccines? Yep, yeah, Erica, that's a big one. I was going to say, some can be controversial, for sure.
Well, and that's one of the reasons that we're building some of these slides in and information related to myths and facts, as well as how to handle controversial conversations. Because we know as you get into discussions about vaccines, there's a lot of questions out there, and not everybody has easily digestible or even accessible or accurate information about it. And so we recognize that that can be a tough spot to be in if you're being asked these questions or being, some myths are being shared with you and you don't quite know how to respond. So we have can cause autism. You can get the disease from the vaccine. I'll have better immunization from circulating virus versus the vaccine.
You get the flu from the flu vaccine.
You can have
Yes, I'll have that. That's a good
reactions.
one.
Yep. Yeah, yeah.
Some of these are ones that we're actually going to talk about. So, oh, they weren't fully tested. There's another one.
Yep. Lowers the immune system by creating a higher risk for other diseases. Okay. Good. And you can keep putting those in there. We're going to, in the interest of time, just put a few more that we have heard quite often. And we have built into what you're seeing, these last three slides, plus a few of the ones that, well, at least the one that introduced the facts in this are actually straight hot off the press and in final review actually right now, as it includes the talking points for the programs as well as some of these myths. But better to get the actual illness rather than the vaccine was one.
Yeah, someone mentioned that.
Proper hygiene will keep me from getting sick. Vaccines contain harmful ingredients, so you heard that as
Someone
well.
mentioned that. Yeah.
And I eat healthy, so I don't need vaccinated. And I'm sure you've heard other ones or you've thought of other ones or someone's asked you about these. So thank you, Diane, for sharing all that wonderful information. I think it kind of brings it to life for individuals. But as we mentioned before, some of those talking points that Diane just shared with you are the types of things that we built into easy and ready to use resources and tools so that those talking points are already integrated in a way, again, that are non-threatening. They don't take up extra time away from your actual EFNEP presentations. And it makes it easily accessible for the people that are hearing the message. And then we've got a variety of additional adult immunization education resources. So we talked about that toolkit becoming something bigger now, and it started out as an EFNEP adult immunization education toolkit. Then we realized we've got some of these things for those individuals that might have diabetes, and what are some of those talking points that make sense for that population. So with our Dining with Diabetes and our DPP program, for instance, we've got additional talking points that map out into some of those sessions as well. And then, just in general, in extension, with our family and consumer sciences and our partnerships with pharmacies, those that may not be EFNEP provider or EFNEP educators, but might be connected to those in the community who are offering out information. So we wanted to make sure that we developed a resource tool, final name to be mentioned later, but basically it's a series of resources. And one of those things includes a beginner's guide to understanding and implementing adult immunization education. And so what you'll get with this as we finalize it is overview, goals, and guidelines for understanding the why of and how to implement your own adult immunization education program. It's got educator training resources for staff, and that includes, for instance, the Vaccine 101 resources that can actually help people get that baseline information of what vaccines do and answer a lot of the questions, for instance, about, the mRNA. Resources for community events. So Diane described a few of these, but resources that you can kind of just print and go or access and come up with your own ideas for, adapt them, which includes display pieces, posters, flyers, brochures on the different types of vaccines. We're working with one state who's created, I believe it's Texas A&M, who's created brochures that really describe what are vaccines, and then specific ones on like RSV and shingles and COVID-19 and such, so that there's different types of brochures that you can distribute as the needs in the community would indicate. And then recipe cards, for instance. And there's a new calendar out that is seasonal, that's actually helping you think about how to do the planning, the menu planning, the doctor planning, all of those different types of things for health on an actual family calendar. We have different resources for programs. So we just showed you a few of the PowerPoint slide decks. There's videos, the talking points. There's a complimentary guide going with those slides to help talk people through how to use that information. And then activities and materials for kids and their parents as we do some additional community nutrition education in the communities. And then social media campaign tools, again, both in English and Spanish, and we have a few other languages sometimes, depending on the communities where these different types of social media campaign tools are shared. Resources for partner agencies. So we're developing some ready-to-go vaccine education modules, resources for schools, parent letters that can kind of go home with the kids, and then robocall scripts. So lots of great ideas being generated and tools being developed for this, this resource hub. And then, of course, the most important, well, I shouldn't say the most important thing, but if you're going to continue to have sustainability, a big part of that is having evaluation. And I know a lot of times that's an afterthought, but we built that into this resource with a bank of evaluation questions that move from engagement all the way through behavioral change for users. And we also, right, Diane, have made sure that this isn't going to be an added burden for our EFNEP professionals who are already tracking a ton of metrics. So we want to make sure that these common measures are easy to access and use. I mentioned, for instance, those online Vaccine 101 training modules. One example of that comes from Arkansas. So immunity in AR community, our community is nice pun on play on words there. And they are actually looking at the learn, understand, and decide. And so this is a series of modules that actually helps you understand how to talk to your doctor about deciding what's right for you. One of the aspects of the Excite program includes integrating vaccine education into existing curriculum beyond just EFNEP. And so we, again, talked about that first one here, but diabetes prevention, health training, and capacity building. The one from Clemson also brings into it HPV information and vaccination. We've partnered with Mississippi, who's brought it into a junior master wellness. So they're actually getting youth who are becoming peer advocates and ambassadors for understanding vaccines. Community health worker training is in the works. I just mentioned talking to your doctor. Idaho is doing poverty-informed care. So how do you really engage and understand what it means to be in that resource-limited situation and to work and understand how best to bring this topic into those instances. Heat resiliency is actually an interesting one based on climate and the impacts of climate on pests and other variants. And what does that have for us in the future? Which, wow, that's going to be a good one to find out, Diane, right? Especially as we go through this. I don't know if y'all are having it right now, but the heat dome, I'm sure, is having some impacts on some things right now. And then the Vaccine Coalition integration through the University of Missouri, and living with diabetes with Virginia Tech. So you can see that a lot of these lead LGUs who had already received dollars from Excite funding are really creating a variety of materials that are going to be really easily accessible. Just another example, that one was immunization resources for EFNEP and diabetes prevention. So I won't go into all of this, but you can kind of see that we've got curriculum overviews, some learning objectives, and the different formats that they come in. And then you can learn more by going to the Excite page, as well as the individuals who created it. So we'll be sharing more of this on our main Excite page as we continue to build this out. We already talked a bit about social media tools and campaigns. Additional non-curriculum go to things that can be resources without implementing a full curriculum, right? And so things like messaging for family and community health, pharmacist messaging, that annual health and wellness planner I just mentioned. The seasonal talking points with University of Arizona is actually creating recipe cards, a podcast, a bus ad, and seasonal talking points that can be adapted. And then Utah State COVID-19 outreach tool for farmers and rural adults. And then Washington State is actually helping people understand community motivational interviewing that gets at how do you best have a conversation and how do you deal with controversial topics with individuals as you're working in this space. So those are some additional tools that'll be part of that. And again, I mentioned the evaluation. We're identifying between 1 and 4 common measures evaluation questions that can be added to any of these programs that you would end up implementing that are generalized enough to allow some flexibility, but specific enough to get us some information that we can then share, which I think is really incredible, because when you think about the impact of extension across the nation, and we've gone through this forever, right? If you do a program, maybe less so with EFNEP because you have very specific metrics, but with extension in general, maybe you're doing a parenting program. And sometimes it's one time that you talk with individuals, and other times it might be upwards of 6, and it might be a 1-hour program versus a 6-hour program. And so how do we identify ways to garner that impact information? So we're working very strategically on that evaluation set of battery questions that can be, some would be highly encouraged, and others would be additional value add-ons that you could do based on what you're doing in your state. So our timeline, so like, when is all this going to be available? Well, this is, I know I'm looking at Diane and smiling because we are doing our best to meet this timeline. So we've had been some committees working on different aspects of that toolkit that I showed you on the first slide. And that's been happening since March through May. Starting in May, we began the finalization of some of the materials. So that's kind of evolving and ongoing. So as each new resource is done, it gets moved up for graphic design and some pilot testing. And then we're going to do a pilot with cooperating states. And Diane will be able to tell you a little bit here about what they're doing very specifically under her lead. And then we're hoping to train and implement a soft national launch of these materials in the spring of 2026. So when we say spring, we're really talking maybe January through March is when you can really expect to be seeing a lot of this.
So why does this path matter? Well, we didn't want to drop the ball after all of this stuff that our EFNEP educators learned about, and they gained these new skills and they gained new knowledge. A lot of people call the EFNEP staff, the original community health worker. Okay, they've been in the community working on health issues, including nutrition, for over 50 years. And of course, Extension's been in the community for over 100 years. So as we know with the federal budget, the EFNEP budget has been pretty stable. So this not only provides some cushion for their, for their positions, but it also broadens the EFNEP educators' role, expands their wheelhouse a little bit. So we're talking about holistic health issues and holistic health promotion. And this kind of will open the door to maybe some other opportunities for us in EFNEP down the road to share other health-related information to our EFNEP participants. So increasing funding opportunities, and we're connecting with others in the community nationally and locally that we may not have connected with before. I mentioned my coalition, my immunization coalition in Delaware, and my immunization mobilization coalition in Delaware. It's 2 different groups, believe it or not. I attend those meetings now regularly just to see what's going on, so I can, keep a pulse on immunization education in Delaware and what others are doing, and see if there's any potential partners that would benefit from some of the things we are doing. Okay, so what's coming up next? Many of you have probably heard about the Extension Foundation's funding, again, through CDC, through USDA NIFA, where there's going to be 4, I'm going to say 4 in quotation marks, new positions in each land grant region. So in the Northeast, we chose to divvy up one of those positions. So it's not one person this is funding. So in Delaware, we will have a health agent, a health literacy agent that will be funded through this Excite program that's going to be working in Maryland and Delaware. But there's also something else exciting we're doing. And together with my colleagues at the University of Connecticut University of Rhode Island, and University of Vermont. I saw Mars on, so thanks for joining us today, Mar from Vermont. We're working together to integrate this curriculum, these messages into our adult EFNEP classes. So we're using the funds for one of those positions over a 3-year term to sustain this model. And I just found out last week, so excited, that LSU will be joining us as well. So very excited about that and helping them feel this out, because they didn't do, I don't think they did the original EFNEP Excite grant. So I'm excited to share that information with them. So we will be having an Excite adult immunization education website, like Jackie said, with a lot of these resources on there. But our goal is going to be to pilot this curriculum that our work group has been working on and getting it out there. We get updates every day from our designer. So it's in the design phase now. So like I mentioned, it'll integrate a lot of those EFNEP messages with immunization education, and also talk about those facts versus myths that we mentioned earlier.
Yeah, and I want to be clear. I said that the timeline was going to go through a soft launch in the beginning of the year. That's really focused on this aspect of the EFNEP model sustainability piece. There's going to be, through that immunization education website, an ongoing addition of resources and materials that are, some are available right now, and others will continue to be added as we work on that in the coming weeks.
So it's very exciting. We're getting these new health agent positions across the land grant region. I mentioned Delaware. We're getting a position and sharing it with Maryland. Actually in the interviewing or reviewing application stage right now for that. And then our other position will be the EFNEP project. But Cornell University and West Virginia they're also getting one of these agent positions. So each region, including the HBCUs, are getting these positions. And it's very exciting to see what's going on and to see what everyone's doing in their community to tailor it to the needs of the community. So like Kentucky and Tennessee, they're reaching out, it's their regional positions, they're housed there, but they're reaching out to the different Appalachia communities. Hawaii is doing the islands, of course. California is going to be focusing on the migrant worker, primarily the Mexican migrant worker, and educating them. So there's a lot of exciting things. And if you don't know where your land grants positions are going or what your regions, ask your extension director. They've been talking about it on the regional meetings. So you'll get to see where these agents will be housed, and they can be a resource for you, and because they're going to be educating other agents in the cooperative extension arena.
Right. And as Diane mentioned, each of these regions got to decide their own approach to using these positions. So they're all pretty much looking a bit different. So some of them are very specifically putting dollars toward EFNEP professionals. Others are doing it a bit more broadly for health agents and health and wellness agents, depending upon what's needed in the state. So for instance, in North Central region, they're working through their medical centers through at least 3 of their states, maybe 4, where they're partnering with those individuals and pharmacies to create some momentum in their states.
And Arizona is going to continue their work with diabetes and integrating the messages in their diabetes prevention programs. Idaho is doing their poverty-informed care like they've been doing before. So some of these are sustaining some of the work we've already been doing in Excite. So here's just a map of where the health agents will be located across the country. Although, like I mentioned, Delaware, we have one housed in Delaware, it's also going to serve Maryland and possibly South Jersey and Southeast Pennsylvania. So that's still, we don't have to keep them in Delaware. We can share them with the region. So don't feel like you're missing out on something if your institution didn't get one of these positions. These willing to share.
And the goal is to bring specific understanding of what each of these is doing and those resources, and continue to share them again on that resource hub, so that we can use the strength of the network of extension to take this global. Yeah.
So we mentioned some of these already. I think I've mentioned almost all of them without even this slide. There you go. So I mentioned Arizona's doing the diabetic adults. California is doing the migrant communities, Tennessee, Kentucky doing the Appalachian communities, and Idaho is doing the individual living in poverty informed care. So lots of different focuses, lots of exciting things going on. And all of these will be presented at NHOC next year if anyone plans on going to the
And
National
NHOC
Health.
is yep, sorry, go ahead.
It's okay. The National Health Outreach and Education, did I get that right? Conference that will be in beautiful Utah next year.
Okay, so just to close us out here, we also wanted to mention some other excite projects that are not necessarily related to what we just shared related to EFNEP and vaccine specific immunization education. So I think many of you have heard about, and maybe not, H5N1 breakout. You may have heard the importance of not drinking raw milk, making sure your milk's pasteurized, thinking about the fact that the avian flu has made its way into cattle and specifically dairy cattle and milk. The pasteurization process, one of the things we're doing through Extension is help people know that that pasteurization process has been really effective over hundreds of years. Maybe it's only been 50. I can't quite remember exactly how long we've been pasteurizing. But anyway, our goal is to really work with a lot of the farm workers and the producers who are dairy and make sure that they're aware of different things. So we have been doing developing a web page for that specifically. We've got resources again for that with fact sheets, one pagers on biosecurity, checklists for being safe and for farm workers who are moving from or who are working with dairy and then maybe even going to different places like vets move from one farm to the next. We're doing some neuro testing to really look at what impacts effective brain-friendly messaging. And it's been exciting to see these resources that we just developed. We had them neuro tested where people actually had different sensors and ways of tracking their heart rate and where their eyes moved and all these different types of things to figure out what is effective messaging. And we're going to be able to use that in the next set of different resources that are created. And then we just came up with an animal safety at fairs set of resources to help people think about how do you keep your animals safe, how do you keep yourself safe at fairs, and what do people even have to worry about when they're participating in these exhibits and fairs. And then we've been asked by the CDC because of the work that we did with Excite and the last set of programs related to vaccination to really help them focus on measles and the key outbreaks in some of the states like Texas, Kansas, and Oklahoma. And so I've just included a link here for some additional things about our resources. This is just a quick view of our one-stop shop for science-based information on H5N1, and you can see the link here, and maybe one of my colleagues here can also point you to that in the chat. But you can see we're working on worker protection, how to stop the spread and to protect our animals and our workers as it relates to H5N1. And these are just some examples of the brain friendly, and you can see how easy they are to read. It's the difference between reading, no offense, as our partners indicated at CDC, some of the great science that comes out of there versus how we like to be able to present some things very easily to our audiences. These are just examples of some of those social media posts. And then as always, in Extension, we want to make sure that we have a chance to evaluate ourselves and provide more information to you that you think might be useful. I hope that you'll take just a minute if you have time after we finish up here today, take a snap of this QR code and provide some feedback for myself and Diane as we continue to work on the information we have related to this and how best to share it with others. But what I'd like to do now is just open it up for some sharing about what you might be doing locally, questions that you might have, thoughts and ideas that you have for us. Feel free to take your mic off, and then Melanie, if you can help us look through the chat, we'll see if we can answer any questions or give you a chance to share.
And Jackie, on that previous slide, it was over a century of pasteurization of milk.
I should have known that because I actually reviewed that social media. You know how it is.
I understand. My public health background just I'm like, it had to have been around the turn of the century.
Yeah. Well, and those are some of the media points that we're making, which is that Extension has been, a lot of people act like Extension and health is new, right? It's always been agriculture, but it's always been agriculture and health and well-being. And our FCS program has existed in the focus on health and well-being and vitality with our community development and the development of our youth in 4-H. We've been doing health. Health is one of the four, right? 4-H is in 4-H. And so just being able to tell that story about how long we've been a trusted messenger is important. So any questions? Any thing you'd like to share about what you're doing locally? So question, did any educators, agents ever experience any pushback from the communities you are educating? If so, how was that overcome?
So of course, these were done in different areas. We're a little bit more vaccine friendly in Delaware than other places. So when my staff came across someone who was kind of like, why are you telling me this? He's like, I'm just giving you a message. I'm just sharing information and resources with you. I'm not telling you to do it, but I'm just sharing the information with you and you can do as you like. I see Donna's on here from New Mexico. I didn't know if she wanted to add anything of their experience in New Mexico during this, but some parts of the country are nicer and more friendlier to vaccines than others. So I
And
think, go ahead.
And I was going to say, we have had some experience with this in extension now with COVID-19 as early as 2020 when we got a lot of pushback. I know at Ohio State, for instance, because we were required to wear our masks. There was a mandate for getting the vaccine. And I know a lot of our educators took a lot of pushback from individuals and a lot of even sometimes public shaming. And so that's one of the things that's been really helpful about this is, again, with the motivational interviewing. And one of the things that we're creating in this toolkit is understanding vaccines, understanding what your potential myths are going to be versus the facts. And sometimes I would even say avoid calling it myths when you're actually talking about it being a myth is one way. And then also how to handle kind of tough conversations. We're going to be providing some language for individuals to actually just use those words. But in addition to that, as Diane mentioned, we're really here to present the information and science as it stands today and to help people make their own decisions about their healthcare, just as we do with so many other topics. Good question. We have 15 seconds left. If there's no other questions, we absolutely want to thank you so very much. Oh, look, Melanie just put pushback and hesitancy around vaccines led to, the media and communication team to create that toolkit. And so if you go to that link directly, you'll have a lot of excellent information that once again also be highlighted in the adult immunization education website. So thank you for your time. Please do take a moment to give us your evaluation. Don't hesitate to reach out to either myself or Diane at the contact information we just left on that last slide. But thank you for your time. We know that it's hard to give up any parts of your day with as busy as you are. Keep doing the great work that you're doing and know that we're here as a resource. And we'd love to shout out your accolades too. So share with us the great things you're doing. Thank you so much.
Thank you all very much. Thank you.
Thanks, Diane and Jackie, for all the wonderful information that you shared. And wow, we have so much to look forward to in these next few months and Excite. So thanks again for being with us today. And if you didn't see in the chat, I will be sending all of the slides and links that were shared and the recording to everyone who registered so you can go back and reference those and share. So thanks so much. And we hope to see you guys next time.
Thank you.
Bye.